Okay, here we go talking about hepatitis. It's found in chapter 53 of your EG Med Surg book, beginning on page 1166. What is hepatitis? It's inflammation of the liver, and it's commonly caused by viruses. It can also be caused by substances such as alcohol or medications or some chemicals. Hepatitis can be caused by autoimmune diseases and metabolic type abnormalities. There are several types of hepatitis, hepatitis A through hepatitis E. If you look on your study sheet, you're going to find that hepatitis A and E are very similar. How so? They're both transmitted by oral fecal route, food and water, undercooked food, okay? And then we see hepatitis B and D are going to be very similar because they are both from blood and body fluids. And then there's hepatitis C that is from blood and body fluids as well. So what are signs and symptoms of hepatitis A? It often goes unnoticed. What type symptoms would they have? Maybe some vomiting, maybe fever. Okay. So they're going to have those flu-like symptoms. All right. So how is hepatitis A diagnosed? They're going to use those specific serological markers, and each hepatitis has its own. So the sero marker for hepatitis A is going to be a Hep A. They're looking for the anti-Hep A antibodies. And if it's positive, then that means that that patient has hepatitis A. How is hepatitis A treated? Okay. You just rest. Okay. And how can you prevent from catching hepatitis A again? Okay, so hand washing. There is a vaccine. And then post-exposure immune globulin can be obtained within 2 weeks of exposure if you're a family member having to take care of someone with hepatitis A. But usually good hand washing will help that. Okay? Now let's look at hepatitis B. We've talked about how it's transmitted. What are signs and symptoms of hepatitis B? Yeah, they have symptoms. Some of them may not have any symptoms, but there's some that do, and again, it's like flu-like symptoms. They're like at the very top of this document, they may have some GI symptoms like nausea, vomiting, stomach pain, loss of appetite. They may have some fever, feel fatigue. The urine will be dark. The stools will be clay colored. They may have some joint pain, may have some jaundice. Those are typical signs and symptoms of a hepatitis. Okay, or they could be very mild where they don't really present. with a lot of symptoms. How is hepatitis B going to be diagnosed? Again, with that serological marker test for Hep B. All right. So how is it going to be treated? Rest. Body will take care of itself if it's acute. And if it's a chronic hepatitis B, then they're going to get an antiviral medication, interferon. How can hepatitis B be prevented? The vaccines, the 3 series of hepatitis B vaccine. Okay. Let's move along to Hep C. Hep C is transmitted through body fluids, IV drug use for both B, C, and D. What type symptoms will they have when they have hepatitis C? The symptoms are going to be more pronounced. The jaundice, again, fever, fatigue, dark urine, clay-colored stools, may have joint pain, may have some GI symptoms. How is Hep C prevented? Is there a vaccine for it? Okay, but there's an immunoglobulin that's available, right? No, that's exactly right. So what are you going to have to do to prevent getting Hep C? Wash your hands. Sharp precautions, and don't be that careless nurse that leaves a needle in the bed linen for housekeeping to get stuck. Don't be that careless nurse that throws a needle in the garbage can. Don't be that careless nurse that wants to dig down into the sharps container to get something. I've seen nurses do it. Okay? All right. Let's talk about hepatitis D. Is it common in the United States? Okay. Not common. What do you have to have in order to get hepatitis B? Hep B, exactly. And how can you be tested for it? The antibodies, those serum logical markers for Hep D. All right. What is treatment for hepatitis D? The antivirals interferon. Okay. We've talked about hepatitis A. Is there anything different we need to mention about hepatitis E? Hepatitis E usually clears on its own. There's no vaccine. If you're traveling, you need to boil your water or use bottled water. Wash fruits and vegetables. Make sure that you're cooking your meats very thoroughly. Now, what labs will the nurse be concerned with monitoring of a patient that has hepatitis? What lab will you be looking at? The liver function test, the liver enzymes, the PT, APT, the albumin levels. What will they look like since there's liver dysfunction going on? Okay. All right. Also for hepatitis, there is a liver biopsy can be obtained, or they can get an ultrasound as well. Now let's look closely at treatment for hepatitis. They're going to have to alternate activity with rest. I think you have a plan in your book on page 1170. The plan for care with every hepatitis that there is that they need to rest the liver. Okay? So they're going to rest the liver, which will help promote hepatic regeneration and strengthen their immunity and prevent some complication. So the first way that they're going to rest the liver is through their diet. what type diet will they be eating? High in carbohydrates and calories, because they're going to need it for energy. They're going to be fatigued with hepatitis. So they need high carbohydrates and calories, a moderate amount of fat and protein after their nausea and anorexia subsides. So they're going to be eating small, frequent meals instead of the 3 standard meals. Another way that we will manage fatigue is that during that acute stage, when they're so fatigued, the rest is going to help reduce that liver's metabolic demand, and it increases the blood supply to the liver. So that's, again, another important reason why they need rest. They don't need complete bed rest, but they need rest periods alternating with periods of activity. Drugs of any kind are used sparingly for those that have hepatitis because, again, they're trying to allow the liver to rest. They will give some antiemetics to help relieve nausea. And because of the life-threatening nature of chronic Hep B and C, a number of drugs are given, including the antiviral and immunomodulating type drug. So if you look on page 1171, here are some examples of the antiviral type drugs that are given. You have the tenofovir. Let me say that again. Tenofovir. That's it. That's right. And then you have the lumidodine and the entecavir. So that VIR is going to be your clue that this is a antiviral type drug. And then there are second generation protease inhibitors that work as the interferons that will be given as well. Do remember that anytime an interferon or a immunomodulator type drug is used, this makes that patient more susceptible to infection. So remember, like the immunomodulating drugs that we talked about, like in the cancer class and the immune class, you're going to teach that patient to avoid crowds and people who are infected. Okay? All right. Let's see what else we want to say. On this study sheet, it talks about the type diet. It talks about the drug therapy that will be used. Make sure that you're providing teaching about sanitation and personal hygiene for hepatitis A and E, washing their hands before eating and after using the toilet. If they're traveling, and especially in non-industrialized countries, they need to drink only bottled water. And they need to avoid food washed or prepared with tap water, such as raw vegetables, fruits, and soups. Avoid ice. Hepatitis can be transmitted through blood and body fluids, so you want to remind them about not sharing razors, nail clippers, toothbrushes, water picks. Use a condom during sexual intercourse. Cover cuts or sores with bandages. And if they've ever been infected with hepatitis, they should never try to donate blood or a body organ or any tissue. So again, you read through the recap. You see Hep A and Hep E are very similar in how they spread. Hepatitis B, C, and D spread through blood, body fluids. And again, this information tells you the vaccines that are available for A and also B. And then it just has really good information about the lab results, what you would be looking for, and then it recaps about the function of the liver. What questions do you have about hepatitis. I think I'm going to pause it. We have a next activity about name that condition. This is to review the hepatitis. We'll see how you do. Okay, I want you to read what's on the screen. It's caused by a virus. It's transmitted through uncooked meat. May be transmitted during pregnancy. Supportive care is treatment. No vaccine available. What is that? Which hepatitis is it? All right, let's see if you got that right. And you are correct. These are symptoms of hepatitis E. And what are some symptoms that you'll see with hepatitis E? Someone remind us. You're going to have GI symptoms, dark urine, reduced appetite, fatigue. Okay, so how do we prevent hepatitis E? Hand washing. Use bottled water. Purify that water when washing your vegetables or when cooking. Avoid any raw, undercooked meat. All right? Name that condition. It's caused by stress and smoking. It may cause pain, nausea, and vomiting. May get better without treatment. May cause anemia if bleeding occurs. Treat it with diet and medication. This is not one of the hepatitis, but what condition is it? It's one of the exemplars that we've talked about. We didn't talk about it today. We talked about it yesterday. So what is it? Okay. And it is peptic ulcer disease. Okay. What are some symptoms of peptic ulcer disease? You're going to have H. pylori. What is H. pylori treated with? I'll load this on Teams for you. Okay. And? Okay. Or H2 antagonist. Okay. And remember, there's different types of peptic ulcer disease. Don't forget about your stress ulcers, gastric ulcers, duodenum ulcers, and the cause of it. Okay. Now, this is one of the hepatitis. Transmitted through fecal to oral route, usually short duration, causes jaundice, nausea, fever, abdominal pain. Vaccine is available. You only get it once. Hepatitis A, that's correct. All right. Name that condition. Spread by blood and body fluids. Most common liver infection. usually has no symptoms. Virus can survive outside the body for a week. High percentage leads to cancer and or cirrhosis. A vaccine is available. Okay. And that is correct. And you can see how someone could get hepatitis B, and you see the symptoms of hepatitis B. Name that condition. Transmitted with body fluids, causes rapid damage to the liver, no approved treatment, vaccine not available, only occurs as a co-infection. And that's what it is. It's D. Name that condition. Caused by virus or bacteria. Signs and symptoms are fatigue, edema, proteinuria. There's no cure. Caused by inflammation. May lead to dialysis. Which one? Okay, C. And usually the dialysis patients will pick up this hepatitis C just from receiving their treatment. All right.